Hi, this is Dottie Howe, Communications Director at ChronoSync, which is managed by the Ohio Health Information Partnership. We have a team of ChronoSync staff here today to do a demonstration for you where we walk you through parts of the community health record, and this is your onboarding session. We have Karen Bishop, we have Andrea Perry, and we have Victoria Redden. So let's get started. What we'll cover today. Well, the purpose and scope, an overview of ChronoSync. Andrea is going to talk to you about security, privacy, and consent, patient education materials, community health record profiles, prerequisites and training, and finally, support. Our purpose today is just to introduce you to the community health record, to prepare ChronoSync participants to use the community health record, and tools such as the Referrals module, and finally, the main purpose is to improve the information exchange among members of the patient's care team. ChronoSync overview. Well, first, we want to explain to you that we were founded by the Ohio Hospital Association, Osteopathic Association, State Medical Association, and the Ohio Department of Insurance. And we're grassroots, we're community and statewide, and we originally started with federal funds but are now independent. We have a board of directors made up of physicians, hospitals, health plans, IT experts, long-term care, and consumer group. And we have an advisory council that gives us advice on the day-to-day operations because these are the individuals who are actually using our products. In the ChronoSync community, nobody is left behind. As you can see, hospitals, physicians, behavioral health, long-term, post-acute care, health plans, allied health organizations such as social service agencies, public health, commercial labs. We have 148 hospitals actively participating now, at least 1,500 organizations connected, more than 2,100 clinicians using the community health record, at least 175 practices using the community health record, and 400 plus long-term and post-acute care facilities who especially use direct messaging. To check the hospital status of these 148 hospitals, please go to this link or just to www.clinisync.org and search across the top for member resources, and you will find hospital status. This tells you whether the hospital is now live, which means it's sending results and reports directly to physicians, whether it is somewhat in progress along the development, or if they have not yet started. As for ChronoSync Services, well, we have Connect, Integrate, Notify, Contribute, Consult, and a directory for direct messaging. But today we're going to talk about Connect, the community health record, clinical results inbox, direct messaging. Today we're going to concentrate on how we can connect providers with one another, and a vital, critical piece of that is the community health record. This allows you to access a single community record on one of your patients if they have had a health encounter at any other ChronoSync hospitals, and some physicians now are starting to publish information about those patients on the community health record. It gives a more comprehensive picture of your patient's health. We also have clinical results that can be delivered to you, referrals, and direct messaging. And as I said, you can see within the community health record the treatment history, hospital encounters, problem lists, allergies, lab results, radiology, and other transcribed reports. Practices find it helpful because they can get the latest demographic and insurance information. You can view, print, or download these encounters or a full continuity of care summary for your records. There's also the ability to query Ohio's automated prescription reporting system, ORS. With referrals, you can electronically send and receive customized patient referrals where you can confirm and track it in real time. It reduces phone calls and faxing and helps you coordinate referrals so that you actually learn whether or not follow-up has occurred. Direct is a way of sending secure, encrypted emails to others within the direct system in Ohio and nationally. This is point-to-point and solved meaningful use requirements for hospitals who wanted to send CCDs to providers. Direct is not like a regular email, it's protected. ChronoSync leverages the Medicity Health Information Service Provider, or what's known as a HISP, and Medicity is our technology platform. We are Direct Trust certified, which allows members to send secure encrypted emails to one another to any other HISP that is Direct Trust certified. If you want to send and receive secure emails with attachments, you can join the 15,000 providers in our statewide directory. This is used by many LTPACs as a more efficient method than faxing or hand delivery. So I'm going to turn it over to Karen Bishop, who's going to give us a closer look at the community health record.
Thank you, Dottie. So on the first slide, we see a picture of the ChronoSync portal. This is where you will log in to the community health record to find information about your patient. For EHRs with the capability, you can also work on an SSO project or single sign-on project where you will be able to launch the community health record from within your EHR. The next screen is the patient search. So when you're searching for your patient, you'll enter information such as first name, space last name, space the date of birth. You'll notice the patient ribbon. The patient ribbon will follow you regardless of the screen that you move through within the patient's record, so you can ensure you're always on the correct patient. You are also able to create a CCD from the information available within the community health record. You can download this particular CCD in a CDA format, which is capable of upload within EHRs as their technology allows, or you could print it to your local Windows printer or print a file as a PDF. Next, we're going to look at the demographic screen. So the demographics is created from ADT contribution or admission discharge transfer information from the contributors of ChronoSync. Likewise, the face sheet is also created from the contributed ADT from our data contributors. So within the patient summary screen, you will see both the 3 most recent contributions under each category, plus you are able to launch into that category to find additional information. Under the encounter screen, this will show you the visit level encounter for that particular patient to help you get a clear picture of that particular visit. You can also create an encounter summary from that data. And again, this is downloadable in the CDA structure that may be consumable by your EHR, or you're able to print. Within the results screen, you're able to see the data from our data contributors, and you will notice that each of the results has the same look regardless of the contributor. This occurs by the integration process the hospitals and other data contributors go through with ChronoSync. This is the hospital patient information flow to give you a better idea. So the hospital system sends to ChronoSync ADT information from the registration system primarily. They will also send lab, radiology, transcription, to name a few. Then the hospital will send that information into ChronoSync where it is normalized, where we create a master patient index, and where we move through patient matching. Then we're able to send this data outbound to physician offices or other organizations in different ways, such as a PDF file delivery, an inbox, or the practice's EHR. The next tab that you'll see within the community health record is the medications tab. So within the medications tab, you will see allergies such as food allergies, and you're also able to query the ORS database. That is for both the prescriber and their associated delegates. And the last tab is the Documents tab. So within the Documents tab, you will notice any of the CCDs that you have created while you were on the patient, which I call created on the fly. Those will actually go away once you navigate away from the patient. However, Other data contributors also send CCDs, and those will be stored there for your viewing. Those are there of a more permanent fashion, if you will. This is a CCD contribution project flow. So the ambulatory organization will send the data to ChronoSync, and how that gets to us is the patient presents to receive care. That is documented within the EHR, and then it moves into ChronoSync via secure transport. Here we will normalize, again, match the patient and build that MPI. Now the methodology and model for each EHR vendor does vary, but this is the general flow. That information then is transferred into the community health record, and that's what you'll see under the Documents tab. And now I'm going to turn it over to Andrea Perry, who's going to speak with you about security, consent, and privacy.
Hi, my name is Andrea Perry, and I'm the Privacy Officer and the Director of Community Outreach for the ChronoSync Health Information Exchange. Today I'm going to go over how an administrator or user can create a secure environment for the ChronoSync HIE by reviewing our security and consent policies. First, we want to talk about security. It's important to ensure end-to-end security of information that flows through the Health Information Exchange. The way that we recommend doing that is by requiring all participating organizations to confirm that they're HIPAA and high-tech compliant and have met and exceeded all of the HIPAA security obligations. We ask this to ensure that participating organizations' individually identifiable health information is protected with reasonable administrative, technical, and physical safeguards to ensure its confidentiality, integrity, and availability, and also to prevent any unauthorized or inappropriate access, use, or disclosure. There are some requirements when it comes to securing the physical environment that the ChronoSync HIE will be accessed from. Participants are required to maintain a secure environment for all ChronoSync-related infrastructure services and data to support the secure and reliable operation and continued development of the ChronoSync HIE. This includes implementing and enforcing appropriate administrative, physical, and technical safeguards to protect the confidentiality, integrity, and availability of all data access through ChronoSync. Participants are also required to employ security controls that meet applicable industry and federal standards so that the information and data being transmitted does not introduce any viruses, worms, or unauthorized cookies or other malicious software to the HIE environment. It's important that users who are no longer with your company have their username and logins cut off. When it comes to deactivating users, it's your responsibility to be sure this takes place. And while we do audit usage, we're not in the position to know immediately if an employee is terminated or leaves the practice. We are happy to assist you with disabling accounts if needed, but we really need you to let us know if a situation has come up that needs to take place. Now I want to go over the permitted uses of the ChronoSync CHR. So participating organizations are required to limit their use of data to those permitted uses outlined in the participant agreement that you sign, the ChronoSync policy manual, and also in compliance with all applicable state and federal laws. Specifically, and without limiting the foregoing, this is directly from our policy manual, the participant agreement limits the use of data by participating organizations to uses in support of your organization's own treatment of your own patients, payment for their healthcare services, and other uses as permitted by law and public health reporting. There are some expressly prohibited uses. These include self-lookup, looking up your spouse or your child or your family, a family member or a neighbor. Also looking up any individual that you or your organization does not have a treatment purpose for searching for that patient. It's also prohibited to look up any of our ChronoSync staff. And I do want to point out that a participating organization cannot access or use PHI from the HIE or any proprietary information held by another participating organization to compare patient volumes, practice patterns, or to make any other type of comparison. An audit trail is created for most actions a user takes when logged into the CHR, and we will initially be running reports on a weekly basis during pilot phases to keep track of usage. After our pilots are completed, we continue to run audits, and there's some things that we'll be looking for. And these things include accessing a patient with the same last name, or accessing a user at a facility where you work, accessing a patient who's flagged as VIP in the HIE, or multiple emergency overrides for the same patient. As well, we also look for patient ages that are outside of the normal range for a practice. Example would be a pediatrics practice searching for patients who are over the age of, say 40 years old, and that patient gender does not match the practice specialty. We also look at whether or not an organization is accessing information outside of normal business hours. Reporting a HIPAA incident. So all incidents need to be reported to your site administrator or directly to our ChronoSync security officer. We ask that you please report anything you suspect might be a violation of HIPAA or the ChronoSync policy manual. We're really here to work with you to address any concern you have, and we'd rather you let us know if there's something that you're not sure about so that we can work with you to decide whether it is or is not an issue. Okay, now we're going to talk a little bit about consent. Just as a refresher, the community health record will give a user access to information from all of the hospitals that are participating in the HIE, as well as any ambulatory physician practices or other facilities that have decided to contribute data. We also have a referral tool that allows you to get information from practices that might refer a patient to you. And these aren't necessarily practices or hospitals or organizations that are contributing data to the HIE, but they all are interested in referring a patient to an organization and sending some of their own data along with that referral. So our consent policy requires that every organization that's enabled with query has to have an effective method to notify every patient for whom data is accessed of that organization's participation in the ChronoSync Health Information Exchange. So again, this is only if you are query enabled, so you're searching the community health record or you're using the referral tool. You have to notify the patient that you participate in the HIE. And this can be done by following the two components in your notice of privacy practices or another written notice that you present to your patients, such as a brochure or a flyer that you have when they present at your practice. The two things that need to be included are the fact that you participate in health information exchange, where the patient's information can be shared and accessed. And you don't have to necessarily list out that it's the ChronoSync Health Information Exchange, just that you participate in a health information exchange. And then also acknowledge that the patient can opt out at any time and a description of the process of how that patient would opt out. There are 4 ways that an organization can execute a patient's decision to opt out. I've got them listed below. First is predominantly an approach that a hospital might use, which is adding a ChronoSync consent flag in an ADT message. The second is training your staff on the ChronoSync consent tool and logging into the community health record and changing a patient's consent status. And we can work with you to set up one of your users with the access to do that. The third is that you can send us a support ticket requesting that a patient be opted out. And the last is separate of your practice, but the patient can contact ChronoSync directly and complete a notarized form that's available on our website and send it to us, and we will opt them out. So when is notice not required? There are some functions that we as an HIE perform that in our role as a business associate to our clients that don't require consent. These include things like we are handling the delivery of results or pushing results to an ordering provider, the creation of our master patient index, and the delivery of direct messages. And when we are either performing these functions or performing these functions on your behalf, we're a custodian of your data, and we're directing that data on behalf of our covered entity clients in a traditional business associate role. So there's no requirement to have the patient's consent to do that. So just as a refresher, notice is not required if you're using direct messaging, if you're receiving results directly into your EHR through other automated delivery, or for public health reporting. But notice is required if you're using the HIE's community health record or our referral tool applications. And you also have to have a treatment relationship with the patient to use the community health record or the referral tool. So here's some sample notice language that we've provided. We don't require that you use our language specifically, but we wanted to provide a sample for you to use if you choose to use what we've prepared. We do ask that you change that last sentence for whatever your opt-out process is going to be for your facility. So hospitals and many have elected to put that a patient can opt out at any time by notifying the Health Information Management Services or Medical Records Department. Some of our physician practices have selected to just list that a patient can opt out at any time by notifying the office administrator. This is my information. If you have any questions about this presentation or anything related to our policies or privacy and security of the HIE, feel free to contact me at any time. I do have a couple of questions, a quiz, if you're interested and want to stick around for this portion of the presentation. So the first question is, are you allowed to look up information about yourself in the community health record? The answer is no. You can't look up information about anyone unless you have a treatment relationship with them, even yourself. The second, is there a record of every action you take while logged into the ChronoSync HIE? And the answer to that is yes. We monitor and audit access to the CHR. We run reports to look for irregular patterns and inappropriate access. Are you allowed to look up information about coworkers in the community health record? The answer to this is no. You cannot look up information about coworkers, family, friends, business associates, or anyone else that your practice does not have a treatment relationship with. What has to be in place before you go live on the community health record? So before you can go live on the community health record, you have to provide patients notice that you're participating in HIE and can access their information from multiple sources. This is different than the type of access you have today, and the patient needs to be made aware of this. Can I share my ChronoSync password? So the answer to this is no. You should never share a password to an application that contains PHI. That's the end of the presentation. Thank you.
Thank you, Andrea. This is Dottie again, and I'm just going to talk to you a little bit about some customized patient education materials that I will create for you. This is a trifold. Your logo goes on the front. The request to change consent is actually on the back of this trifold. And essentially, that request to change consent is simply if someone decides that they want to opt out of the system. So automatically, everyone is in our master patient index who has visited a hospital that is connected to ChronoSync. And we also are having some providers start to publish data also to the community health record. And if you have a patient that wishes not to be part of this, you need to have them fill this out and take care of this at your practice level. Depends on whether you have our consent tool or not, but essentially what you're doing is changing their status. So they are automatically opted in if they have visited one of these facilities, and you're going to opt them out. Or they've gone through a series of visits or hospitalization or something where they change their mind and decide they'd want to opt back into the system after having opted out. You will use this form. We request that you try to take care of this at the practice level instead of having them mail it in, because then that involves a whole process of notarization. So there's your logo. And then inside the document, this is written at about the 8th grade level. It goes over automatic consent, why this is important information for your physicians, for your treating doctors, how it saves time and lives, improves patient safety, gets results quicker to you and to your physician, and is private and secure. We also have a flyer that you could hang up on the wall that essentially has our language in it. If you have any questions, you want to send your logo to me for a customized brochure, here's my contact information. Now I'm going to turn it over to Victoria Redden, who's going to explain provisioned roles for you.
Thank you, Dottie. So our CHR access profiles just define for you how you'll be accessing the CHR and what kind of access and rights you'll have within your given role. These defined number of roles can be provisioned for different authorized users for management and auditing purposes. Participating organizations are responsible for specifying how job descriptions impact what kind of CHR profile you want to have. We do not dictate for you what kind of CHR profile you should have based on your job description. It's really up to you as your site admin to determine what's best for your resources. So here I've listed several different CHR profiles. You can see we have varying level of access between clinical and consent. The registration profile has access to the patient consent tool as well as some demographic information such as insurance. The clinical profile only has access to clinical information. It does not have access to the patient consent tool. However, the clinical plus consent is a bit of the combination of two roles. You have access to the consent tool as well as the full clinical patient chart, while only the consent profile has access to the patient consent tool. Your referral profile has access to the referrals and demographics information, but if you want referral and clinical information, you will also need access to the referral plus clinical profile. The Complete Connect profile is really just a way to combine all of those in one. You'll see that there's no X here for demographic and face sheets because that's already included here on the full chart access. We also have the ability for you to query ORs under any kind of clinical profile, whether it's just clinical, clinical plus consent, referral plus clinical, or Complete Connect. All of those you will have the ability to choose whether or not you would like to access the ORS database to search controlled substances through ORS. And now I'll turn over to Karen to review prerequisites and training.
Thank you, Victoria. So let's discuss some of the prerequisites for training. So there are a few items that you will need to complete before we can get your organization ready for training of the community health record. So we will provide to you a CHR profile assessment and user build forms. We'll also need for you to provide to us a copy of your updated NPP, which Andrea spoke about earlier. You'll need to tell us what your decision is on how you wish to opt out patients. So that would be within the profile access that Victoria discussed. And if you're going to use secure messaging, you'll also need to sign and return a Diva form. This is a copy of a checklist of the prerequisites to help you move through the project. So as you can see at the top, the contracting and onboarding are already checked off because a requirement of onboarding is that you already have a signed agreement. And what you're watching today will also meet the requirement for onboarding. You'll see at the bottom of this form within the gray highlighted area, again, the review of those prerequisites so you understand what you need to have completed before your project moves forward. So let's chat a little bit about the user build form and some of the things that you need to complete. You will see tabs about asking for general information about your organization and your providers, as well as we'll ask you what your service selections you would like to use and the user details. If you're using referrals, you'll notice additional tabs that are necessary. This is a copy of that user build form. You'll see that there are instructions and it is color-coded to each tab to help you drill down into the necessary information. If you are going to use ChronoSync for secure messaging, this is when the Diva comes into play. So one thing you will need to do within your task for completion of the Diva, you will need to either have a ChronoSync trust agent or a notary sign on the form. They will need to review your government-issued photo identification and ensure that that information matches the data in the form. This verification is completed by DigiCert, and these are their rules. Here is a copy of the Diva form, or Direct Identity Verification and Authorization. You will notice under the red circled area under Applicant, the home address. This is a required field by DigiCert. Now let's discuss some of the prerequisites again for your project. So again, we're going to need you to complete the project assessment and user build form. Send a copy of your updated NPP disclosing your membership with your participation with ChronoSync. You'll need to let us know how you're going to manage opted out patients and if you're using secure messaging, the Diva. All these materials should be submitted to your community outreach manager or ChronoSync designee for processing. So what are the next steps? So once you've met all the prerequisites, your ChronoSync outreach manager or designee will follow up with you to schedule a 15-minute call to discuss a preliminary. So once all of the prerequisites have been received, your project will be packaged and placed in queue. ChronoSync will follow up with you via email and schedule a preliminary training call to discuss training. And what will you expect from training? So if you are just using the community health record, we will conduct on-site training to again review the NPP and workflow, discuss with your staff how you're going to manage opt-out requests. We'll show them how to navigate the system, discuss training materials, help them log in, and discuss our support process. At the end of that training, your organization will be live on the community health record. Before we leave your location, we will ask the site administrator or project lead to sign off on a form indicating that you're alive. We also have additional support documentation to provide to you. If you're also going to be using the referrals application, there is a bit more build involved. We find that it's handy for the build team to meet with the ChronoSync representative initially to do things like setting up options and build and maintenance within the application. Then we will bring all your users back to discuss the same things we have with the CHR. And we'll also discuss how to manage referrals. And finally, just like with Community Health Record with referrals, we will have a project wrap-up where you will be live on the Community Health Record and you'll sign off on a form and be transitioned to support. For secure message training, if we happen to be on site training for another solution, we can also move through the secure message training with your staff. However, we do have a recorded training video in supporting documentation so it can be self-learning. If you have any questions, please contact your community outreach manager. And now I'm going to transition it back to Victoria Redden to speak with you about support.
Thank you, Karen. As Karen mentioned, once you have all of your prerequisites complete and complete your training, you will then be transitioned over to our ChronoSync support. Our ChronoSync support team will help you with any issue you're experiencing. Support covers all products and services we offer for you. So if you're experiencing any issue with your access, an issue with data in the system, or just have any concerns of any kind, you can reach out to us at www.support.chronosync.org. If you do submit a support ticket to us that requires patient information in order for us to troubleshoot your issue, please be sure not to include any kind of PHI in that submission. We request that you do not include PHI because our support portal is not HIPAA compliant. If you do have an issue that requires patient information, just let us know that you have it, and a support agent will follow up with you securely to collect that sensitive information. You can also give us that information on our support line at 1-800-645-8192. Also, feel free to call that support line anytime. It is 24/7, so if you have a critical issue especially, like an access issue that you need to get to a patient chart to take a look at, go ahead and give us a call. We'll make sure we give you all your access, reset your password if needed, and we'll help you out in any way we can. Once you complete your training, you will be given support documentation that includes this contact information, as well as some other handy troubleshooting tips should you have any issues. So of course, if you have any questions or have any trouble logging a support ticket on our support portal, go ahead and feel free to call our support line at that time as well. And now Dottie will show you how to stay informed.
So thanks very much for listening to us today. I wanted to invite you to visit our website anytime at www.chronosync.org. There's two forms on there that would be helpful for you. One is you sign up for services, and that would be if you wanted to look at any other options than what we've discussed, you could get to your community outreach manager or send this in and it actually goes to me. I also invite you to subscribe to our ChronoSync Connects newsletter, where we put out a monthly e-newsletter that highlights events that are occurring, webinars, association events, information for you about meaningful use, PQRS, and other quality reporting programs, and keeps you up to date on the newest products and services at ChronoSync. I just wanted to share with you the philosophy of our leadership, which is that HIE, or Health Information Exchange, isn't just about technology. It's about community and trust. It's about people working together across different parts of the healthcare field, across all parts of the state, so that we can help the citizens of Ohio have a better quality of life. Thank you for listening.